Good morning, John. I've got the list of patients for today and noticed that Mrs. Wise...
Sorry, can I just finish this? Right. Who have we got this morning?
It's quite busy today. Looks like the receptionist hasn't quite got the hang of the booking system, and Mrs. Wise has
Here,
been...
let me have a look. Oh, no, Emily Wise. She's a lovely lady, but she takes forever. And this morning's full, very full. I promised to fit Fred Townsend's new bridge first thing.
And there's a couple that have been sent in from the Access Centre for further treatment, and Miss...
Thank you, Lizzie. I don't mind doing this, but sometimes I wish that somebody else would have a turn. If reception would do as I asked and run the book properly, we'd all be able to cope a lot better. And, oh great, that's all I need. We've got Kate Wilson coming in to do the DPA inspection.
The DPA?
Dental Practice Advisor, Lizzie.
Yes.
It's okay for Kate. She gets paid a good whack for coming around and checking up on me. And I know it's all in the cause of governance or whatever else they can think of, but sometimes I just wish the board would leave me alone.
Well, we could see...
Not to mention that this week, apart from the DPA this morning, I've got to go to the mandatory IRMA course on Friday. Total waste of a day. Nobody gets treated. Sometimes I wonder why I bother. I might just retire, you know. Sorry to keep you waiting so long. I know we were supposed to meet 30 minutes ago, but you know how crazy Monday mornings can be.
That's fine, and thanks for agreeing to change the date of the visit at such short notice.
No problem. Right, let's get those boxes ticked, shall we? And you can go off and see someone else. I can get back to work.
Okay, well, you and I have both done enough of these together for you to know what's involved. I've completed the full dental practice advisor inspection of your practice against nationally agreed criteria. I've looked at your infection control, your surgery equipment facilities, health and safety processes, staff administration, blah, blah, blah. You know the drill.
Yes, indeed. So, what's the judgment this time, then?
Well, you remember that last time we spoke about certain administrative practices, and I'm pleased that improvement seems to have been made there.
Well, that's good then, isn't it?
It is, but I do reckon you are still not up to speed with the induction of new nurses. You know, making sure they get their CPD done, and ensuring that their vaccinations are up to date. And you don't have your COSH or other health and safety documents in place.
Haven't I?
I know it's boring, routine stuff, John, but it is important. You know, suppose one of your nurses catches Hep B and you hadn't made sure she was properly vaccinated and trained. You would be in big trouble, you know that, John. Not to mention the fact that it is the board's responsibility to make sure that you're getting these things done, so my job is on the line as well.
Kate, we've known each other a long time now. I'm sure there's a way around this. By the way, I've been thinking you and Andrew should come over for supper sometime. It's been absolutely ages.
This is really very easy to sort out, John. I mean, we can help you with the induction protocols and the health and safety protocols. We can even get an infection control nurse out here to go through it all with you. I know it takes time, but a lot of it is just paperwork that the board and I can help you with. All you need to do is to tailor it to your individual circumstances. You've got a great practice here, John. Lizzie's a cracking nurse. She really knows her stuff. And she thinks the world of you, John. She puts in a lot of extra hours despite having young Tom to look after.
OK, point taken.
Well, look, I know that you did remodel the practice after the inspection a few years ago and you've enlarged the waiting room, but there is still the partition wall between the waiting room and the surgery. Well, we've spoken about this twice before, John. There is the possibility that your patients can hear you asking personal information.
I try to provide a really good service for my patients.
I know you do.
And they're well looked after. You don't get complaints, do you? I see them on the NHS, they get a great service and we're always here. And I like to look after my patients, I always have.
And we are here to help.
But I haven't got time for all the paperwork, all the bureaucratic shilly-shallying that goes with it these days. And I understand that the board needs to be reassured over standards of service. And you, swanning in here to check up on me. It's always nice to see you, Kate, and actually the four of us should get together. Shall we check our diaries?
I don't think now's appropriate.
Look, I know the staff need training, but In the old days, I just got on with my work. No board to bother me, no protocols, no paperwork. Just me, the patient, and the DPB.
John, they weren't really the good old days, were they?
And don't even start to talk about the hours that I work my staff. They've got a good life here. I'm a good employer. All right, I sometimes run over.
Sometimes?
Well, that's understood when I take them on. It's all about give and take. And to be honest, it's not always easy finding quality staff these days. I've got a new receptionist who's an absolute waste of space. Double bookings galore when I've got bridge preps or Morendo appointments, all because she can't get her little head around the new IT system. And she lets patients stay here when they say they want an emergency appointment. Take Mrs. Emily Wise, for example. There'll be nothing wrong with her. She just wants to come in for a chat. Our new receptionist hasn't learnt the art of putting people off yet. Today she hasn't even turned up for work, no explanation. So Lizzie and I are really pushed.
I appreciate that it is difficult.
And it's not just administrative. Despite being registered, dental nurses today are an absolute joke. Not a patch on the old ones, the ones that I trained up myself. I mean, you say Lizzie's good. Dizzy Lizzie, I call her.